This is what I'm talking about. It's very long Pontic. Awesome. Thank you. Thank you. It's a 7-star. We have a lot of 7-star cases here. All of a sudden, we made a temporary, which is doctor sent to us the photo as well. So I noticed that this is from the denture. I noticed that this is bulky. I don't like that. So we designed this more better, bringing in. Not like class 1 is just a little bit fat to me. Especially chrome cover, zirconia crown, I have to give them more room than usual. Still see I see a little bit the facially out. Then when I can bring it in down, bring down to the lingual side. So what I do, so doctor mounted and just one by one here, just grinding like this. I love this forward ball. Like here, so we set the tissue, but I don't want this is tight like that. You see, this is the starting. So once I set up the one, the other one, same thing, lateral alignment, those kind of thing. It's a great example for Citon 7-star. Is mainly little bit, sometimes a little bit issue because we copy with the existing denture. Okay, so we send it out to PMMA and then they try in the patient's mouth, and which is they said okay, pretty good, but to me it's a little bit bad. You see, bad. I don't like it. If I'm a patient, I don't like that. So I always, our employee do is to make more room, so make the better tooth contour than this, which is more flatter. It look like more teeth, and then I can make the more individual. The problem is PMMA I cannot do sometimes because it's cracking easily, and then this one I have to grind this a lot, so I can make very very thin frame, which is here. So I show you guys all the time about frame design. Is all the time just make edges better instead of the class 1. That's my point. So once you set up, we just pre-pack after milling, and we just noticed that to some of that area is still fat. I don't like it here. Why? This is a chrome cover, so I'm going to do the porcelain top of this. So this to me is already finer. So what I do all the time grinding, or I can let designer know more flat like this. This is another tip, right? Okay. Make sure this side too. Make sure underneath open. I prefer put into the porcelain top of that. So whenever I take it out, still I see facial a little bit out. Just starting grinding. And then here, grinding, and then I can make you can make the maximizer here. I can make the little bit margin line. After margin line, the belows I make more down. I don't want bulky because you see the metal, you see the more out than this. Same thing, bring it in, a little more. Make the same margin line CJ. Okay, and then here's out. Okay, single this one to make sure the undercut, no undercut. Okay, now is alignment is most another important thing here. I want alignment like this. Since this sticking out, I don't like that. I like this kind of thing. So then I can make the finer, I can get a better harmony, teeth harmony. So I have to trim this. By the way, I'm using the carbide bar from Horiko, Germany, which is I got sponsor, which is here's a little bit bad. But there two is excellent. Like my job is easier like this. Okay? No undercut. This is the final stage. So I can make the individual. Make sure it's not too bulky. Here's our margin line. You see? Alright. Put your underneath. That's good. Same here. And then if I do, to take it out. Let me show you the underneath. Looks like they put two. They're smart. Look at this. Okay, so this is what I'm talking about. This is the final PMMA. If I make the zirconia, we have to make it like this thick, no matter what. The problem is this much is a foot trap. Look at it here. Now let me show you the how much I grind more here. So this is a Pontic. Here is a pink porcelain. It's even more thinner than this, right? That's why it's item 7 size different. I know the price is high, but that much we dedicated. Beautiful job. And then here, so I can cut it a little bit more. So I can cover with the porcelain, so we can get the extreme hiding case than ever. And then very strong. And also underneath here. And also I can cover with the porcelain, no ceramic. So this is upper, yeah. So my margin line here is very thin. Okay, I can cut here, so I can use the porcelain. See, this is our Pontic side. That's why I highly recommend this item 7-star case. This is the final framework. The lower is the same thing. I can trim more than here. So I can get the 1 and 2. No, here. Okay. Now look at this. You see? Huge body. But if I do lower, you see, I have to make zirconia like that. Otherwise, you get fracture. Okay, so make thin. So this area, the same thing. I can grind more. And then I can use the porcelain. So this is only porcelain. Okay, so that one is only porcelain. And here. That one's only porcelain too. Okay, so this porcelain shape, I don't have to make this one thicker. I can bring down. See, I can cover with the porcelain here. You see, this is a panel. If I make the zirconia, we're going to fracture here, 100%, 100%. Okay, so I put here more down. Cover, and this is a beautiful 4-mouth item 7-star case, the final framework, and then we can put the top of this as opaque, and then we can show you the other project too. 7-star case is exceptional case. The first is really thin. Okay, same thing, the chrome cover ceramic. So temporary is most of the times we base on the problem fracture if I make the very thin. Okay, so we have to make a little bit thicker because then not going to break it. However, our ceramic, which is chrome cover underneath, especially here, implant side definitely, and we can do with all ceramic. And not only that, we change the angulation from the implant side or angle screw channels. This is the our custom art from the 3-unit bridges monolithically created the aesthetic as possible from gingiva contour tissue color shape. And then we set up the curve of Spee and Wilson. So we're not going to use anything about the composite. It's ceramic here. Let's make it more detailed, individual lookings. And this is called Titan 7 stars. We only can do better than any other dental laboratory. I know I'm arrogant, but this is we give the patient world class. See this one, world class full mouth implant ceramic. Look at this implant size, very large underneath tissue. From implant size huge. Even though we made it very thin, especially here too, like this. All right. 6 implant lower finish it based upon the PMMA we fabricated. Now is upper. This is top and bottom cases, maxillary and mandibular cases. 3-unit bridge, same thing. We did it with the ceramic porcelain layer, and here is monolithic with the stain techniques like this. And the proximal contact is excellent. Razor form and contour. It is surface textures. Use the 3 lobe and then create it. It's nice. It's a reflection for 3-dimension color. There too. Contact is there. With excellent cases. Same thing. It's really super thin. It's monolithic. Based upon PMMA. This one's before cementings with ceramic. You see the texture and then color. Extremely good. And also here's between the implant side. This is another great skill levels fabricated in between the implant side, and then make sure they're all comfortable for tongues. Here is 2. Let's make this very detailed. It's natural lifelike restorations, just like here by different light sources, and that's made the ceramic. We can get the good centric occlusion here. You see the tissue and differentiation with the surface texture. It's not shiny, but it's a good amount of luster. That's possible because it's very thin, right? It's very, very thin here from the bulker and linger, or interiors, regardless. Here, you see, it's very small. This is lower. Take it out. Just like that. Push it. Okay. So they can get this really cleanable Pontic as much as possible here. the 24 unit, another 7-star cases. Like I said, we made the every day we made the Citon 7-star cases. So I know I kind of a little bit arrogant, but I know more the problem and issue that I can figure it out, so we can solve the problem as much as possible. Because whenever doctors place the implant with all different direction, some dentists really good, some dentists has a little bit limitation from the patient situation, so they cannot do much about it, or maybe financial issue, they cannot do much about it. But same thing is my goal, and this dentist actually she's came from Michigan and sent cases here. Her name's Dr. Sharitha Uchil, and then I can indicate here a name too. And then she and I do a lot of Citon 7-star cases, the full mouth zirconia implant, which is chrome cobalt cases. And then same things, we want to make the really extremely thin, the restoration with the ceramics, not composite. Okay, so composite meaning denture, acrylic, or a lot of people do with a titanium bar, with this apply the composite, which is totally different than ceramic. Ceramic is more plaque resistance, and then the more lifelike, more longevity. Is not like much denture looking, but this one is more our highest skill level, which is I indicated about the specific design. Regardless, is bigger Pontic from implant side, bigger Pontic, and then implant positioning. We make it as thin as possible from the try-in basis and then PMMA basis too. So finally, we made this great job about this, and then patient have this excellent restoration here, and actually his doctor's mounting here, so we can mounting here too, doctor's mounting as well. And then finally we finish is excellent lifelike restoration. So thanks for watching my channels. If we publish it all the time, the most likely Citon 7-star full mouth zirconia implant ceramic cases, which is not many people can do. Maybe they can do, but not as good as aesthetic us. So we just dedicated, more passionate, and then created, and the better the aesthetic, and also it's good, it's functional aesthetic, functional occlusion, and then we match it because of the facet, or class 2 from class 1, or class 3 or class 1. Okay, so glad just finished this restoration. So full information is available from LSK 121. And again, thanks for watching my channels, and then you can see more further information, and or any question. We do have a lot of questioning from the patient side, so they can feel free to email me or email us. Is mail mail at lsk121.com. So we can introduce our client from nationwide. We work with over 46 different states. So you can get this is proper or good treatment plan. And then I hope you can get the best maximum aesthetic, functional, not bulky, not thick, not heavy, not cracking problem, not 1-2 color, which is the regular shade guide looking, but this is the we made by the natural as possible, natural color, meaning it's more enhanced enamel, it's close to natural color looking, which is God provided here, which is God create our natural teeth. So that's about it, and then we can see you the next time, which is next week. Thanks for watching my channel. This is what I'm talking about. It's very long Pontic, and then here's a one implant site, and then that area usually crack. Okay, but this one make chrome cobalts, you get the maximum strength. This is not a problem. And then here it's like with the tissue side and snug fit, and that's the best quality here.